This is Focus on Your Health. It's brought to you by Kingman Regional Medical Center in historic Kingman, Arizona. I'm TG LaFredo, and this is the Best of 2015 edition of the show. I took over this program in October of 2013. I've learned a lot since then and gotten in surprisingly little trouble. I've talked to doctors, nurses, pharmacists, nutritionists, patients. I've talked to my wife, our neighbor, the pest control guy, pilots, cops, a priest. We jumped in the mud on this program, and we delivered a baby on this program. We visited the Arizona Poison and Drug Information Center. I interviewed the director of the Arizona Department of Public Health. I spoke to a woman whose sister overdosed on heroin. I spoke with a 4-year-old whose mom was serving in Afghanistan. I've recorded in doctor's offices, parking lots, hotel rooms, my truck, my house, on the street while running a 5K, in a garden, at a pork eating contest, in a thunderstorm, at the scene of a motorcycle crash, and in a helicopter on the way to Phoenix. You'll hear some of that one in a moment. The point is this. It takes some time to put together this material, and I didn't want to create single-use programs. I didn't want to air them once and then have them disappear down the memory hole. So in the summer of 2013, I started posting episodes to YouTube. And YouTube allows me to track when people are listening and where in the world they are. So now, a year and a half into that project, I've compiled the stats, and I'm proud to share them. I'm a bit humbled, really. In the past year and a half, Focus on Your Health has reached listeners in 47 U.S. states and 51 countries. I'm delighted and maybe bewildered to think that this program that originates in a small town in the Mojave Desert has reached listeners all over the globe. 51 countries, as I said. And here now to read a list of those countries is Victoria, a text-to-speech application. Hi, Victoria.
Hello, thank you for having me.
It's always fun when you stop by.
It is my pleasure to be here with you.
Okay, so you're going to share with us a list of all the countries all over the world where people have listened to Focus on Your Health. Hit it.
The United States, the Philippines, Canada, Australia, Brazil, Spain, Portugal, South Korea, Italy, Belgium, the United Kingdom, Hungary, Azerbaijan, Peru, Indonesia, Trinidad and Tobago, Chile, Greece, Malaysia, Nigeria, Japan, United Arab Emirates, Germany, Netherlands, India, Taiwan, Norway, France, Switzerland, Albania, Russia, Hong Kong, New Zealand, Austria, Isle of Man, Belarus, Latvia, Bangladesh, Guatemala, Mexico, Slovenia, Tanzania, Turkey, Armenia, Colombia, Finland, Rwanda, Saudi Arabia, South Africa, Poland, Denmark.
Excellent work, Victoria. Thank you.
Rock and roll.
And now on with the best of 2015. During the summer, we aired a program where we flew with Guardian Air. Guardian provides medical transport all over Arizona and all over the West by helicopter and fixed wing. In this clip, I'm spending the day with the Kingman-based crew, and we get dispatched to a motorcycle wreck on US 93 outside of Wickiup, Arizona. Here we go. We are Angel 6, and we're about to depart Kingman Airport in a Bell 407. Our pilot is Mike Mickelson, a former Marine who's been flying since 1978. He flew for the Arizona Department of Public Safety for 20 years, and he's flown over a decade with Air Methods and Guardian. The flight paramedic is Ashley Steinberg, and the nurse, and my tour guide, is Eric Music.
Ready when you are, sir. Clear! You're clear! Clear! You're clear!
Kingman, Victoria 3322 Foxtrot, West 8, runway 21. Driving Angel 6 helicopter midfield, will be departing to the east. Crossing midfield west to east, low level, any traffic please advise. center, Angel 6.
Angel 6, go ahead, sir.
Yes, ma'am. Angel 6 just cleared the airport Kingman en route to 117 on 93. 4 on board, and we've got 2 hours and 10 minutes of fuel low risk.
Copy that. Departed the airport 4 POB 210 in fuel, en route to the scene low risk at 1419.
We don't really know what we're going to find when we arrive on scene. At this point, all we have is that it's a motorcycle crash with 2 riders down. We'll land on US 93, just north of Wickiup, Arizona. It's a well-traveled stretch of road, but it's remote in that it's a long way from there to a hospital. There is a little excerpt of the Guardian Air edition of the show. If you'd like to hear more of that, you can just go to YouTube, search for Focus on Your Health, and better yet, search for Focus on Your Health Guardian Air, and that episode will come up. You can check out the whole thing. Those guys were fantastic to work with, and I thank them for their time and their dedication. Let's keep moving. We had a number of good adventures in radio in 2015. In this next clip, we are going to visit the pathology suite at KRMC. This is Dr. Brent Bedke, and he's looking at slides and checking for anomalies on the different samples that he's gotten.
So I'm looking at a case from a young woman who presented to the emergency room with pelvic pain. And the radiologist looked at some of her scans of her stomach and noticed that she had this mass lower down in her pelvis next to her ovary. And so at that point, the surgeon was called, one of the OB-GYN physicians. That physician took her to the OR and took out a piece of tissue. Now, most of this was that mass that they saw on the scans that the radiologist looked at. So what I'm doing now is after that tissue has been processed, they put it onto a slide, and then I take that slide and put on my microscope and look at that tissue. And so as I'm looking at this slide, one of the first things I notice just at a low power view, which low power means not a very high magnification, is I can see the fallopian tube, and that has the appearance of a bunch of wavy fingers lined by epithelial cells. So a lot of the fragments have the fallopian tube component. And then next to or adjacent to the fallopian tube, I'm seeing a lot of blood and a lot of reactive changes to this. And part of those reactive changes I'm seeing are some really big pink cells. And that's not typically normal to have in the fallopian tube. And so what that means is this lady is likely pregnant. And so during the normal course of pregnancy, the woman's body responds to the fetus by different hormones. And part of this hormonal response is that these cells become very large and pink under the microscope. And that's what we call decidualized cells. And so that's kind of a surrogate marker for this woman being pregnant. Now, I'm not seeing any portion of this slide where I'm actually seeing the chorionic villi, which is the cells that make up the placenta, which would be definitive evidence that this woman was pregnant. But seeing the decidualized cells is a very good surrogate marker for that. So likely this woman had an ectopic pregnancy, which was causing the pelvic pain. So ectopic pregnancy is when a fertilized egg does not make its way down to the uterus and instead is found outside the uterus. And locations for that can be the fallopian tube, the ovary, or even within the abdominal cavity.
So at that point, there's clearly no saving of that fetus.
Correct. So at this point, there is no saving a fetus, and in many cases, the woman's life can be at risk. And so this is an emergent operation. And, the physicians and the clinicians in this case were very astute to this and probably saved this woman's life.
So Dr. No, will you take us to the break in Vietnamese?
Sure. Chúng tôi xin nghỉ giải lao dài Focus on Your Health. Chúng tôi sẽ trở lại chương trình trong vài giây. Đây là KJS, hệ thống đài truyền thanh.
Beautiful. Well done. And welcome back to Focus on Your Health. I'm TG LaFredo, and this is the Best of 2015 edition of the program. And in this next clip, we're visiting with Dr. Linda Williams. She's a clinical pharmacist at KRMC's Disease Management Clinic. In this excerpt, I ask her about her studies as a pharmacy student. I've heard about first-year med student syndrome, where you're reading about all these different diseases and then you start to think you have all of them. You say, I finally figured out what's wrong with me.
Oh, yeah.
Did you ever experience anything like that in pharmacy school?
No. Let's see here. Pharmacotherapy, a pathophysiologic approach. Anticoagulants like warfarin are used to prevent blood clots and stroke. When clots form in the deep veins of the body, it is called a VTE, venous thromboembolism. It is a potentially fatal disorder and a significant national health problem in our aging society. It can strike young, otherwise healthy adults. The common symptoms of a blood clot in the leg are pain, swelling, discoloration, and warmth. The risks of developing a clot are increased from immobility, trauma. I did have some type of pain in my leg yesterday, and I think it was 2 degrees warmer to the touch than it normally is. I'm at increased risk from immobility because I just finished a 24-hour marathon watching old sitcoms from my couch. Over-the-counter medications. Although medications can be purchased without a prescription, they can still cause adverse effects and should be taken with caution. Tylenol can cause rash, muscle spasms, anxiety, even if the adverse reactions are rare, with the incidence rate of less than 5%. I did take one Tylenol 2 weeks ago. Now I have this weird rash on my arm. My eye is twitching right now, and I'm feeling quite anxious. This could all be from that one Tylenol.
Linda?
Huh?
I was just asking if you ever had that first-year med student syndrome.
No, nothing like that. Next question?
That's Dr. Linda Williams. She's a clinical pharmacist at KRMC's Disease Management Clinic, and she's a good sport. In this next clip, we visit with Dr. Leanna LaFredo, and we're talking about colicky babies and lullabies. This is all about sound. Enjoy.
There are some scientists who think that babies who have colic have a problem with their intestinal balance, like the microbiome, and that's why they're uncomfortable and they're colicky. Some scientists say, it could be food allergies. Maybe they're allergic to the milk. And there have been studies in the past linking maternal smoking and nicotine exposure to colic. And then there are also relationships or studies in the past linking maternal depression and even paternal depression to colic.
Oh, okay.
But it seems to be the most common or most popular thinking now about colic is that it's probably secondary to an immature brain or infant dysregulation. Basically, this means these infants are not mature enough yet to help themselves calm down, like they don't know how to calm themselves down. And there was this book written by a pediatrician, Dr. Harvey Karp, who talked about the missing trimester, the fourth trimester.
Okay.
So these infants between, younger than 3 months tend to have the colic because their brains are not mature enough. They're having a hard time adjusting to the external environment outside of the maternal womb.
Right, yeah.
So his book It's called The Happiest Baby in the Block. And Dr. Karp's theory was that the best way to calm babies down would be to recreate the environment inside the maternal womb.
Okay, so I want to ask you about that, but first I want to interrupt because what I'm wondering is if the baby still needs to develop, it's sort of that missing trimester. Is that something that Mother Nature takes care of?
Yeah, in time, because we find that these babies, after when they're about 4 months old, they've outgrown the crying.
Okay. So even if you have a legitimately colicky baby, it's something that should only last the first few months.
Yes.
Okay.
Yes.
All right.
If it lasts longer, you'd have to look for another reason or medical reason for it. They could have reflux.
So tell me about Dr. Karp's recommendations for recreating the environment of the maternal womb.
Well, in his book, he talked about the 5 S's. And basically, these are 5 techniques, all beginning with the letter S, so it's easy to remember. So the first S stands for swaddling.
You refer to this as wrapping the child up like a burrito.
Yeah, and he says to wrap the baby up tightly. This is to make the baby feel really secure. Because when you think about the baby inside the womb, it's really tight in there. And that's the environment that the baby is used to. When you swaddle, it also prevents the baby from startling. They have this startle reflex or Moro reflex. And when babies do that, it upsets them. The same way we get upset when we get startled. The second step is side positioning or stomach positioning. Of course, the recommendation of the AAP is not to have the baby sleep on their tummies.
Right.
But this is allowable if the parents are there. You're there, you watch the baby. So you position the baby sideways or on their tummy, and it is another way of preventing the startle reflex. And then the third S stands for shushing. So you make the shushing sound. So this is when, you hear moms or grandmothers like, shh, do this when the baby is crying.
Yeah, and what's that about? What's the idea?
Well, because the babies inside the womb, they're in a very noisy environment. It's not quiet inside the womb. They could hear the mom's heartbeat. They can hear the mom's blood flow and, other organs there. And so this is what the baby is used to. Shushing is also similar to white noise. And I find this in some parents when they are at their wits' end and they're trying hard to really calm their babies down and they can't. They take their babies out for a car ride and the babies sleep. And it's because they like the sound of the car engine.
It's interesting to me because there's often this idea like, oh, the baby's sleeping. Everything has to be perfectly silent, right? But this is not at all what the womb, the environment is.
Yeah,
correct?
And babies are weirded out by too much, too much silence.
Is that the scientific term for it?
Yeah.
Okay.
So also, some parents report their babies calming down to the sound of the hairdryer or the vacuum cleaner. Yeah. And then the fourth S stands for swinging. So you try to...
Is that where you jump, jive, and wail?
Yeah, well...
Baby, it looks like it's gonna happen.
Close enough.
Okay. All right.
So you try to really, like rock the baby, and that's because the baby inside the womb is floating, in amniotic fluid and seems to be like swaying all the time because the mom carries the baby around all the time. So
that makes sense. Yeah.
It's soothing for them. The fifth and last S stands for sucking. So sucking really calms babies down. Right. Either, some parents use a pacifier, or you can, babies find their fingers or their fists and, help or learn to calm themselves down.
How about lollipops?
I think you don't want to start that habit this early.
Okay. So there's an interesting and relevant study that I wanted to ask you about. You have handy a book here called The Mystery of Risk, and it's by Dr. Ira Chasnoff.
Mm-hmm. He talks about how what mothers do during their pregnancy can affect the infant. He was talking about like drug intake and all of these things that really,
smoking and drinking,
and all of these things that can affect development of the fetal brain. even infants or fetuses they start hearing sounds and they start having memory of these sounds even when they're still inside the womb. And so one of the studies he mentions is by this researcher, a fetal researcher, Dr. Peter Hepper from Northern Ireland. And what he did was took a group of pregnant women and had them watch this popular Australian TV show called Neighbours.
Are you familiar with Neighbours?
No.
Yeah, neither am I. Here's a little bit of the theme song he had them listen to.
Neighbors, everybody needs good neighbors. Just a friendly wave each morning.
Okay, so they were listening to that.
Yeah, so they watched it. He had these pregnant women watch this show about 360 times throughout their pregnancy.
Okay.
And then...
that's a lot.
Yeah, a lot. And then about 2 to 4 days after these babies were born, he had them listen to several sounds, different music. And one of the sounds and music he had them listen to was that same theme song.
Okay. So I presume the other songs and sounds, they were not...
just random, yeah.
Okay.
He found was that these babies, when they heard the theme song for the Neighbours, they became alert. Their heartbeats slowed down. They seemed to recognize the sound, the theme song. Yeah. So,
did Frank Zappa have anything to do with this study? Did they play any Zappa for the kids?
I don't think so. That wasn't mentioned in the study.
They haven't.
But
really
that would be an
yet.
interesting research to find out, how babies reacted to Zappa.
When we were kind of sketching ideas for what we would talk about and how we would get into this, I kind of gave way to an interesting reflection that you had about the senses.
Yeah, we human beings have 5 senses, and it seems as if the sense of hearing is the very first sense to develop because it's the very first sense that gets activated when because it starts even right? in the womb, like it's the sense of hearing, like they could hear even like things from the outside world. Yeah. It can get through into the womb, and then they have a sense of it and they have a remembrance of it. This is what you get from this study.
It's so interesting to think that this kid is beginning to interact and the world is calling this kid out by sound. The kid has never seen anything.
Yeah.
It's wonderful. It's really exciting.
One of the other things that, moms do or have done since the beginning of time to try to soothe their babies is to sing to them and sing lullabies to them. And there is actually research done on premature infants in neonatal intensive care units about how music and lullabies that these mothers sing. So they had these infants listen to them, these premature infants, and they found that there's an improvement in their vital signs, in their sleep patterns, in their feeding when they hear lullabies or music that the parents chose. And it's very interesting, and they're actually suggesting it as a form of music therapy for these really premature infants.
And that is the big show. That is the Best of Focus on Your Health 2015 edition. As we wrap up this program and this year, I'd like to take a moment and thank some of the people who helped to make this program possible. First, thanks to all the good people at Kingman Regional Medical Center. Special thanks to Terry Williams, Sean De La Riva, Scott Kern, and Chris Bennett with KRMC Public Relations. Thank you to Tom and Nicole Erickson at the KJazz Radio Network. Tom is my mentor in radio and a dear friend as well. Thanks to Carrie Hyatt at Radio Central. Thanks to my pal Eric Clemenzi for bumper music, technical consulting, and bass lessons. Thanks to my friends at Telefunken Electroacoustic, makers of the world's finest microphones. And thank you for listening. If you'd like to send me an email, I'd love to hear from you. You can reach me at foyhradio@kjazz.com. foyhradio@gmail.com. That's Focus on Your Health. FOYHradio@gmail.com. I read them all, I promise. Merry Christmas, Happy Hanukkah, Enlightened Kwanzaa, Boisterous Boxing Day, and Happy New Year. I'm TG LaFredo, and I'll catch you in 2016.
Today, Kingman. Tomorrow, the world.